Yeah, so last week we did a demo on the orthogonal tissue regenerative therapy stem cell signaling machine to see if we can stimulate Erwin's deep peroneal nerve because he has Dropfoot. He had a sarcoma skin cancer surgery where it took a chunk of muscle out and apparently caused some severe nerve damage. So for many years he couldn't raise his foot or get the heel strike walking, so he's limping. Let's see if there's any improvements from last week. Okay, sit back. Okay, relax, in control. This is the L4 nerve reflex. Good on the right. He has some reflex there, which is good. Now let's test S1. Relax. Okay, got some reflex there. S1 left. See, he has some reflex, which we didn't have last week.
Yeah.
And then put your feet flat on the floor. You're going to scoot forward. Okay. This is the good foot with all your strength. Push up. That's 5. Push up. Okay, you got a little. And then can you raise your top of your foot up like that as high as you can? This side. Raise your toes to the ceiling. Toes to the ceiling. How about this side? Okay. And both feet, toes to the ceiling. All right. And press the floor into my hand. So you got a little dorsiflexion, not much.
Yes.
Let's see how your walking is. You want to walk down the hall? So you can get up easier, huh? Get up easier? You get up from the chair easier now?
What?
You can get up from the chair
Oh,
easier?
yes.
Walk all the way down.
I tell you, it's a different world.
So before, it was we filmed last week, he couldn't dorsiflex or get that heel strike. He was flopping. Okay, come on back. Watch the left foot. See how he can get that heel strike now? See that? It's not flopping like that. Look at that. You get the heel strike. How many % better is your walking compared to
Oh,
that?
for a short distance, almost perfect.
Perfect. And how long have you been having that drop foot syndrome?
Since
Limping?
1987,
And we knocked it out in one treatment.
I hope.
So how many % better does it feel compared to last week?
Oh, okay, well, good thing I called. I was
Would you,
moving down the list, so.
if I would tell you 90%, would you believe me?
Well, you're 100, so I'll take 90. I want 100. So I'm going to give you another stimulation today
Yes.
and see if we get it working more. Might as well treat you just like that. So I'm going to sit back, scoot back more, keep on filming. We'll do another round. And I'm going to stimulate where, see, Dropfoot either is 3 places. It's in the lumbar spine, L4-5S, L5S1. We ruled that out. He doesn't have any spinal damage. Or where the common peroneal nerve bifurcates in the super and deep, where I was 99% sure it was because that's where the surgery was, damaging nerve. Or where it comes out here, the deep peroneal nerve inferior. But we're going to treat where it bifurcates here. So this is second demo with the stem cell signaling machine.
That's a marvelous machine.
Well, we tried, we injected Wharton's jelly
Yes.
cells, the extracellular vesicles. You got a little results, but this is the one that really made the best results because this is activating all the cells that we put in there. And let me know the most tender spot. The more pain, the better.
Yeah.
Here. See, it's better than last week. Remember, it was
It hurt
Pink?
like
Yeah.
hell. Right there.
okay. On a scale of 1 to 10, how bad is that?
What?
On a scale of 1 to 10, how bad is that?
3 or 4.
Okay. Where before it was a 10, remember?
Ooh,
Yeah, there you go. So this device not only it locates the area of, in his case, where the nerve is entrapped, or the point of
Ooh,
the most pain
ooh,
and inflammation,
ooh,
and it
you
treats
got
it right there.
you got it.
There.
Yeah.
Okay, that's what we want.
Oh. Oh.
So that's about where the common peroneal nerve, it splits into superficial
Ooh.
peroneal here, and deep peroneal where it dives down, it comes out right here at the ankle We're treating where the nerve is damaged here.
Ooh,
You spread that gel around.
ooh.
Is that the most tender spot? And look how it's stimulating the nerve. He's getting a little, see, dorsiflexion contraction.
Ooh,
It's beautiful.
ooh, I feel it all the way down to my toes.
So we know it's working.
Oh.
Erwin, do you feel it in your big toe more or all the toes?
All of them.
Good.
Ooh, ooh,
So we're hitting the L4, L5, S1 nerve roots. So.
oh. Ooh, ooh, ooh.
So this is sending sound waves of shock, sound waves of energy and through water, so it disperses it. It's not focused shock wave, it's unfocused. So we cover a larger surface area because there's a lot of nerve tributaries we won't want to miss. At 3,300 miles an hour, which is faster than the speed of sound, clinically proven to activate connective tissue and stem cell, signaling and activation.
Oh. You're killing me.
Well, you want the results, right? Huh? You want the results?
You're killing me.
Was it worth it? Was it
Yes.
worth? Yeah, there you go. I'm like the dentist. I want the drill to hurt for, so your teeth don't hurt permanently.
Ooh, ooh,
So temporary pain for permanent pain relief. Right there?
ooh.
Okay, that's what we want.
Ooh. That whole area there. Oh.
And we got about 80 pulses to go. Just gonna
Oh.
scan around the fibula a little. Is that good?
That's not as bad.
Okay. I want it where it's where. Right there? Good.
Ooh.
It's even make his quadriceps activate right there.
Oh. Ooh.
A little femoral nerve activation as well.
Oh.
Right there. Is it less? Is it pain a little? Good. You want to treat where the tenderness is the most.
Oh,
Let's
boy.
reassess. I'll wipe that off later. Let me see if there's any increase in your reflex.
You can see it that fat?
Look at that. That's actually a little clonus, but relax. Don't cheat.
Oh,
Look at that. Look at that. That's like night or day. That's a normal 2 out of 2 patellofemoral reflex. And let's see the S1. Yeah, it's still sluggish. I want the S1 to fire. See? Normally it would flex, but we're getting some reflex, which is good. And then let's see your range of motion here.
oh.
Put your feet flat on the floor. Flat on the floor. Okay. Can you lift your toes to the ceiling? Okay, a little. Resist, push up. Resist, push up. Okay, strength isn't there yet, but his reflex is coming. And let's see how he's walking now. Let's see your gait. And walk all the way down to your left. It's like night or day still. He's still getting the heel strike on the left. See that? Come on back. Okay, see that heel strike on the left? He's a lot more normal gait. Is it about the same as before? The same improvements as last week, or even better after the second?
This, you're talking about minuscule.
Yeah, but it took a day for it to. You didn't feel it last time.
What day did we do it
Last
time?
week, yeah.
What day was it?
I think it was Wednesday, right?
Saturday. It took me 2 days.
And then you felt the normal walking.
In 2 days, yes.
90% better walking in 2 days. Wow.
Unbelievable.
All right, we'll check up next week on a third demo if
Yeah.
he needs it. That's good.
Can I